Intro. Have you ever wondered if your body could warn you before a stroke strikes? What if just a few unusual symptoms, something many people ignore, could be the difference between life and death, or between a full recovery and permanent disability? In today's video, Dr. William Lee reveals the 3 early warning signs of a stroke that everyone should know. These symptoms can appear hours, days, or even weeks before a major stroke occurs, and recognizing them quickly could save your life or the life of someone you love. From sudden vision changes to unexpected weakness and warning signals your brain may be sending, you'll learn exactly what to watch for and what to do if these symptoms appear. Stay with us until the end, because the final warning sign is often overlooked, and it could be the most important one of all. Let's get started. Hello, I'm going to tell you 3 stories. 3 true stories. Case 1. Imagine suddenly losing the ability to speak and walk. That's what happened to Jessica, 32 years old, who had given birth to her baby just 4 days earlier. While caring for her daughter, Jessica started to feel dizzy. She tried to get up from her chair, but she couldn't. Her legs were weak. She called her husband, and he immediately noticed her speech was slurred. In less than 10 minutes, he rushed her to a hospital near their home. She was examined in the emergency room. A CT scan was performed, and clot-busting drugs, thrombolytics, were administered through an IV. Instantly, her speech and the strength in her legs returned, and the dizziness vanished. Case 2. This one involves a 62-year-old man, a lawyer I'll call Hugo. He was stressed about credit card debt and was working double shifts. The problem was he had never taken care of his health. He was obese, had diabetes, and high blood pressure, all poorly controlled. It was 2 a.m., and as he was hunched over his computer, he felt a severe headache. It was so intense that he knew something was terribly wrong. He called his sister, a nurse, and then collapsed. He only woke up 10 days later in the ICU. He had undergone surgery, and the doctors had just brought him out of a medically induced coma. Case 3, another woman, 58 years old, whom I'll call Regina. She suffered from arrhythmias, but hadn't seen her cardiologist in years. She was at a family party when she started to feel a tingling sensation in her face. Her daughter told her that her mouth was drooping, and she confirmed it by looking in a mirror. She was taken to the hospital immediately, but halfway there, her mouth returned to normal, and the tingling stopped. Still, after an MRI, she was admitted for observation. What do these 3 cases have in common? All 3 had a stroke. And that is the topic of today's video. Here, you will learn to recognize the main signs and symptoms of a stroke. If you want to protect yourself or a family member from this disease that causes so much disability, watch until the end. I will share a lot of information that you don't know. A stroke can happen to anyone, including young and healthy people. Did you know that stroke is a leading cause of death and serious long-term disability worldwide? Every 2 minutes, someone suffers a stroke, and the scariest part is that many people don't recognize the signs and symptoms in time. But first, please like this video and subscribe to the channel if you haven't already. And check if you've hit the notification bell. Share this video with people you know. I'm sure many will be interested in this topic. And tell me, have you ever had a stroke? Or do you know someone who has? Where in the world are you watching from? Write it down below. Let's begin. The core explanation: time is brain. What is a stroke? A stroke is a medical emergency. It happens because the blood your heart is pumping isn't reaching a part of your brain. And what happens when blood doesn't arrive? That area of the brain will be deprived of oxygen and nutrients, killing millions of neurons every second. That's why we say time is brain. Every minute is critical. Every minute counts. When I graduated from medical school just over 20 years ago, when a person with a stroke arrived at the emergency room, there wasn't much we could do. We'd do a CT scan, and if there was no bleeding, we'd give them aspirin and wait to see the extent of the damage. Today, it's completely different. We have effective medicines to dissolve the clot and recover much of the lost function. And we also have procedures that can physically open the blocked arteries. I have seen miraculous cases. People who came into the ER unable to speak or walk, and after the infusion of the medication, they would start speaking clearly again, squeezing my hand with force, the dizziness gone in an instant, as if by magic. That's why if you or a family member are experiencing the symptoms I'm about to describe, you cannot stand still, waiting for the symptoms to resolve on their own. Don't do that! Take the person to the emergency room immediately. I will repeat this. Time that passes is brain tissue that you are losing. Time is brain. The faster you get to the hospital, the faster the doctor will see you, the faster they can administer the medication, or even perform a type of catheterization to open the affected artery in the brain or suction out the clot. And by doing so, they can save memories, the ability to walk, to speak, to recognize objects, and yes, to save lives. Again, stroke has become a leading cause of death globally, even surpassing heart attacks in many places. It doesn't matter how old you are or whether you have health problems, and strokes are occurring more and more in young, seemingly healthy people. Waiting to see if it gets better can come at a very high cost. The person could die or be left with disabilities that could last a lifetime. So, do not wait. If you've understood this, the video has already been worth it. The tool, be fast. What are the stroke symptoms you need to know that must be on the tip of your tongue? Let's remember the cases I told you about. Sudden difficulty with vision, dizziness, loss of motor coordination or balance, a sudden severe headache, the worst headache of someone's life, like a thunderclap, numbness or tingling in one arm or leg or on one side of the body, weakness in the arms, legs, or face, especially on one side of the body, difficulty speaking, slurred speech, or trouble understanding what others are saying, sudden confusion, problem seeing in one or both eyes, fainting. If you are with someone who was fine and suddenly starts experiencing any of these symptoms, the first thing you must think of, almost immediately, is a stroke. You are now going to learn a very powerful tool that can help you identify a stroke quickly. Remember the acronym BE FAST? B is for balance. Is the person experiencing a sudden loss of balance or coordination? E is for eyes. Is the person having trouble with their vision? Blurred vision, double vision, or a sudden loss of sight in one or both eyes? F is for face. Ask the person to smile. Does one side of the face droop or seem uneven? This is a warning sign. A is for arms. Ask the person to raise both arms. Does one arm drift downward or feel weak? This is a very concerning sign. S is for speech. Ask the person to repeat a simple phrase. Is their speech slurred, strange, or are they unable to speak? Another major red flag. T is for time. If you observe any of these signs, don't hesitate. Don't waste time second guessing. It's time to call 911 or your local emergency service immediately. Every second counts in the fight to minimize the damage from a stroke. The longer you wait, the more severe the consequences could be. The deeper dive, types, causes, and why. What are the types of stroke? There are two main types. The ischemic stroke, which is the most common, about 85% of cases happens when an artery supplying the brain is blocked. This can happen when a clot breaks off from somewhere else like the heart or the carotid artery in your neck and travels to the brain. Or it can happen when the blood vessels in the brain themselves become narrowed by fatty plaques, causing a local clot. The second type is the hemorrhagic stroke caused by the rupture of an aneurysm or a weakened blood vessel, leading to bleeding into the brain. What is a brain aneurysm? Imagine a small, weak spot on the wall of an artery in your brain. It's like a little bubble. With the constant pressure of your blood flow, this bubble can grow, and as it grows, its wall gets thinner and more fragile, like blowing up a balloon. At first it's tough, but as it inflates, the wall becomes thin. And here's the part that truly worries us. If that bubble bursts, if the aneurysm ruptures, it causes a hemorrhagic stroke. And what about a TIA? A TIA is a transient ischemic attack, often called a mini-stroke. It's caused by a temporary blockage that clears on its own within minutes or hours, so it doesn't cause permanent damage. An MRI might show nothing, but a TIA is a massive warning sign. It's your body screaming that if you don't seek help and find the cause, a major stroke could be imminent. It's like seeing sparks. Soon, there will be a fire. Why do strokes cause so many different symptoms? Simply put, the brain is our most complex organ. The symptoms directly relate to the area of the brain that was deprived of blood. For example, the speech center for most people is on the left side of the brain. So, a stroke on the left side will cause speech problems, along with weakness on the right side of the body. A stroke on the right side would cause weakness on the left side and could also lead to memory problems or personality changes. A stroke in the cerebellum can cause severe balance and coordination problems. What are the main causes of a stroke? First and foremost, by a wide margin, high blood pressure. This is the number one risk factor. So, if you have high blood pressure, treat it properly. Other major causes include smoking heart arrhythmias like atrial fibrillation, AFib, heart diseases like an enlarged heart or valve problems, diabetes, high cholesterol, obesity, and a sedentary lifestyle, and a family history of stroke. The modern problem and the solution. Why are strokes increasing in young people? because the risk factors hypertension, diabetes, high cholesterol, obesity are all becoming more common in younger populations. Think about it. How many young people do you know with these problems? I see it in my clinic every day. And a stroke in a young person is devastating, often impacting